Hey guys, it's Doc Heps here with UroCoach, realurology.com. Today we're going to talk about testicular injury, urologic injury. Maybe you've been hit in the balls, aka testicles. It's awful. Maybe you've slipped off a bike seat and hit the bar in the nether regions. How do you know if something bad is going on? How do you know if you should get checked out? Well, watch this video. I'll let you know. Hey guys, it's Doc Heps back with UroCoach, realurology.com. Make sure you subscribe, like, comment. We love to hear from you. Today we're going to talk about urologic injuries, what to look out for, what symptoms you may experience, and I'll tell you towards the end, in summary, what you need to do if there is something bad going on. So we're going to start at the bottom, move up towards the kidneys. Let's start with the scrotum. The most common injury is to the skin, something called a zipper injury, where the skin gets stuck and a guy is zipping up his pants. This is more emotionally traumatic than physically traumatic. Usually we can tease the zipper off of the skin. If necessary, we can cut off some of the skin. It sounds awful, but for us, this is real easy. Numb it up, put a couple stitches in. Typically, the testicle is not involved at all. It's just some superficial skin, and the scrotal skin heals up beautifully. Number two, testicles. So the testicles develop in our abdomen, and then as we develop in our mother's womb, they drop down into the scrotum, bringing with them all the nerve fibers and the blood vessels. So that's why it hurts in your belly when you get kicked in the testicles or balls, because you have that referred pain from all the nerve fibers where the testicles originated. So most times a trauma or hit to the testicles will resolve within a few minutes to half an hour. But if it persists, that could indicate that there is a potential rupture or fracture of the testicle. So the anatomy is such that the testicle is a bunch of tubes that's encased within this kind of thickened sausage-like casing. With the right trauma and something hitting them, like a lacrosse ball, a hockey puck, that sausage casing can rupture and a tear can develop, and some of those tubes can be exposed. If that's the case, you need to come into the OR. We need to clean that area up and sew that tear up. How do you know if something's going on like that? Well, if you have pain that persists, some more swelling and bruising, and then you have to come in. We have to do some sort of imaging like an ultrasound or MRI to determine, is there that type of testicular rupture or fracture. Next up is the penis. The penis is a structure that contains basically 3 cylinders. The 2 cylinders on top are the blood flow and create the erection, and the cylinder at the bottom is the urethra. So the urethra can be injured most likely in something called a scrotal injury. For example, if you fall in between your legs on a fence or on some sort of side of something, or if you fall off a bike onto the bar, you can crush the urethra in between that bar and the pelvic bone, and that can cause a tear in the urethra. That can cause a fracture or total complete tear of the urethra. In either case, you're going to experience some blood in the urine, or you're going to have difficulties urinating. So if you experience a scrotal injury and you have blood in the urine or difficulties urinating, you need to get checked out right away. In terms of the other components of the penis, the erectile bodies, called the corpora cavernosa, those can lead to a certain type of trauma called a penile fracture. What happens typically is a man has an erection, and maybe during activity, that erection gets bent all of a sudden. They would hear a popping sound, they lose the erection, have pain, swelling, bruising, have something called an eggplant deformity. That blood flow, again, is trapped in a sausage-like casing, and if that casing gets torn, the blood flow will leak out. You'll lose the erection. You may hear a pop, and you'll get a lot of bruising. That can be diagnosed with a imaging study, again, an ultrasound or MRI, but most commonly it's just the history, and the exam tells you that there's probably a penile fracture, a tear in that structure, and surgery is needed to go in and repair that tear and help prevent future problems with erectile dysfunction. Next up is the bladder. The bladder is unlikely to be injured alone. Oftentimes it's in association with a big pelvic injury or pelvic bone trauma. So the bladder's usually not injured alone. It's during a major trauma like a motor vehicle accident or something fell on someone's pelvis. Above the bladder are the ureters. These are two tiny structures, kind of like long coffee stirrers or spaghetti. They're about 12 inches each, and these are the tubes that take the urine from the kidney down to the bladder. They're most commonly injured in other types of surgery. The ureters are near certain structures during colon surgery or gynecologic surgery, so oftentimes we can help the gynecologist or the colorectal surgeons identify these ureter structures as needed. And lastly, it's the kidneys. The kidneys can be fractured or injured in certain hits, like in football, or a helmet to the flank region, or a fall onto something in the flank. And most commonly, you'd see some blood in the urine, some bruising on the side, and some side pain. So in summary, what do you need to check out for? If you have a simple scrotal skin tear, you can take the skin off, and oftentimes some local wound care like Neosporin or something like that will heal it up. If the cut is deeper, you may need a couple of stitches. Go get checked out. The testicle, if testicle pain doesn't resolve within a few minutes to half an hour, then you need to get checked out, get some imaging to make sure the testicle didn't so-called explode or rupture. In the penis, if you have difficulties urinating, if you have blood in the urine and you sustained a straddle type injury, a fall onto a fence in the perineal area, you need to get checked out to ensure there's no tear of the urethra. That would be manifest by blood in the urine or difficulties urinating, as mentioned. If you were having sex and you suddenly hear a pop and you've noticed that the erection went away and you get this bruising and swelling, you need to go to emergency room, and they'll tell and determine if you had potentially a penile fracture and you need surgical repair. And really the only other thing to be worried about in terms of a trauma or injury is that if you were playing some sports or you had a nasty fall and you notice blood in the urine, or you have bruising on your flank or severe flank side pain, then you need to get checked out by your doc as soon as possible. So hopefully this video was helpful, informational. I appreciate your time. Again, make sure you subscribe, like, comment. We love to hear from you.